My name is Rudy Evonich, and I'm a cardiac electrophysiologist at UP Health System Marquette. Kind of always enjoyed science, and it was probably fourth grade where I decided that being a physician is what I wanted to do, and it was because I wanted to live in the Upper Peninsula, and I recognized that short of being a science teacher, there's not a lot of opportunities for people who do something in the science field to get a job in the Upper Peninsula. Cardiology was always interesting to me because it made sense. The other interesting thing about cardiology is there were lots of treatment options available, and so that was the thing in medical school that appealed to me. And then electrophysiology was exciting because some of what we do is curative, and so that was what made me gravitate that direction. So the initial patient visit is generally pretty lengthy. I spend probably a minimum of 45 minutes with a new patient, sometimes an hour, sometimes more than an hour. And it's because oftentimes the rhythm issues that I deal with can be fairly complicated. There's lots of different treatment options, and there's no one right choice for everybody. There's a dozen different ways to treat them, and picking the one right choice depends on kind of getting a good perspective of what the patient's goals are and priorities. So the curative ablations are very rewarding, and so I'll see somebody with frequent ventricular arrhythmia that results in severe symptoms, and I do a procedure that takes a couple of hours, and they come back and it's eliminated and they never have it again, and they're very grateful. Sometimes they'll say, I've got my life back. I can do things I couldn't do a year ago or 5 years ago, and that's the really appealing thing. We do all the things here that they do in the bigger centers, and we do them very frequently, and we do them with the same level of skill or greater skill than they do in larger centers. And I think we care about our patients more than large cities or big metropolitan areas.